Let's let others join first. Good evening, ma'am. Good evening, everyone. We will be starting in next 2 to 3 minutes because people are still joining. So let's wait for them.
ओके काफी लोग तो आ गए। तुम भी आ गए हो?
Ayushi, is my screen visible? Ayushi, can you hear me?
Yeah.
Is my screen visible?
No.
I think we can start rest of them. Yes, Monica, ma'am. Ayushi, start now.
Hello, everyone.
Hello.
So let's start. Breastfeeding is the first line of defense for a nation against malnutrition and infant mortality. A warm greetings to everyone. This is Ayushi from the First Step Foundation in collaboration with Rotary Club of Shahid Bhagat Singh College. Welcome you all to this insightful session on a breastfeeding awareness. On the occasion of Global Breastfeeding Week, today we are going to debunk some important aspects of breastfeeding. It is the best gift you can give your child. They will know about mother and child care during breastfeeding, problems facing by new mothers during breastfeeding, their solution, myths, etc. Before starting further, we would like to express our warm gratitude to our collaboration team. Thank you so much, guys, for your lovely support. Now, I would like to introduce you all to amazing guest speakers, Dr. Nirmala Pandey and Dr. Lavesh Pandey. Dr. Nirmala Pandey is senior eminent gynecologist in Ajmer. She is ex-professor of JLN Medical College, Ajmer, ex-HOD of SN Medical College, Jodhpur, and presently working as a senior consultant at Francis Hospital, Ajmer. Now, Dr. Lavesh Pandey has done BDS, MDS from Rajiv Gandhi University of Health Science, Bangalore. She is an ex-professor of Mahatma Gandhi University of Health Science, Jodhpur, and practicing dentistry since 18 years and runs her own clinic, RiteBite Dental Clinic, Ambabari, Jaipur.
Thank you so much, ma'am, taking time for your busy schedule. We are quite pleased to have you here and can't wait to hear from you. Please take the session forward.
Yeah.
Should we start?
Yes, ma'am.
Thank you, Ayushi, for your kind words. I'm Dr. Nirmala Pandey,
Thank you, ma'am.
Senior Consultant, St. Francis, Ajmer. I'm very thankful to the organizers, especially this One Step Foundation and Rotary Club Jaipur for inviting me for such a authentic, I should say, and a lovely debate or a lovely topic on breastfeeding. I will be talking about breastfeeding in two parts. Actually, my opinion is every day is breastfeeding day. So we divide it into two, antenatal and postnatal. Antenatal, as all of you know, is a time when a mother becomes pregnant. So at this particular time, the counseling for breastfeeding should start. She should be counseled. She should be told about the good things of the breastfeeding and how she can feed the child when the child is born. And in antenatal period, certain things should be taken care of. Because some females have cracked nipples, some of them may have retracted nipples. So we should ask them to show to a gynecologist if they have any problem with the soreness of the nipples. Otherwise, usually we advise them to just clean their breast and nipples and apply a moisturizer or a cold cream. Usually the mothers who are there, who are becoming pregnant and deliver for the first time, have this thing in mind, whether I will be able to feed my child or not. I assure every female who has become pregnant and has delivered that yes, you can jolly well feed your child. Because the size of the breast does not matter. It is the secreting glands of the breast which are very, very important. The second question that the mothers ask, now I'm going to come to the postnatal period. As soon as they deliver, they ask us the question, Doctor, when should we start feeding the child? Actually, earliest it is done, better it is. Because the bonding between the child and the mother is very, very good if the initiation of the breastfeeding starts at the earliest. In certain countries, it is a rule to feed the child immediately at the time of the delivery. As soon as the patient delivers, the child is put to the mother's breast. It helps in expulsion of the placenta and also it enhances the milk production. But in India, usually we recommend in a normal delivery that it should be done ideally after 2 hours when the patient reaches her, say, room or to the ward and she becomes comfortable. However, nowadays the cesarean rates are very high. So the patients or the mothers who had cesarean should feed their child within 4 to 6 hours, because when the anesthesia weans off, they are in a better condition to feed their child. Now, all of you will ask, why breastfeeding? Because breastfeeding, the breast milk is just like a nectar, or it is amrit. It is a total food for the child. And those mothers who breastfeed their children, they do lot of good to themselves as well as to the children, to the child that they are feeding. The breastfeed is very, very high in immunoglobulins, in proteins, in antioxidants, in all the nutrients that a child requires. So before feeding the child, we always ask the mother to clean her breast and nipple with a very normal, say, cloth or say a cotton with a warm water. You need not require any antiseptic to clean the breast. And the child should be put to the breast immediately as soon as the mother is comfortable. Because the bond between the mother and the child will be formed at the earliest. And it is very good for the child as well as mother to take their first feed at the earliest. Now the milk, as you know, maybe you are not knowing, but milk is of two types, the fore milk and the hind milk. The fore milk is the milk which has got a lot of water in it. That's why we say that for 6 months, the child should not get any other thing except exclusive breastfeed, because the water content is taken care of. And the hind milk is the milk which has more of nutrients and it is slightly thicker in consistency and it meets with all the nutrition of the child. The mother should feed the child exclusively for 6 months. Nothing is required except breastfeeding. But if she wants to continue feeding the child for 9 months, for 12 months, for 1.5 years, then we should add something to the breast milk. That is, apart from breast milk, she should give her child something else as a nutrient, like she can give dal ka pani, some cereals, some dalia, egg, or some fruits like kela. Banana is liked by the children, and so on. Means after 6 months, exclusive breastfeeding is not there. It has to be added with some nutrient in the form which I have just told you. Now, most of the mothers, they want to know how much time is there to feed the child. I mean, how much time they will take in one feed. Usually the time taken by the child depends from the birth till they grow up. Immediately after the birth, the child's stomach is very small. Hence, the feeds are very frequent. And mother has to feed the child every hourly. But later on, when the child becomes slightly more developed, then the feeds can be taken at the interval of 2 to 3 hours. And the time for the mother to feed the child is around 15 minutes to 30 minutes. Means she has to breastfeed from each breast 15 minutes. There are certain things which should be taken into care when feeding the child. Along with the nipple, the areola should also go to the mouth of the child, because there are lactiferous ducts in the and around areola which help in suckling. So It will also prevent soreness of the uh, this thing, nipples, and it will form better opposition of mother and the child. How do you hold the child is also a question which is asked. So you have to hold the child with the stomach of the child clinging to your stomach. You have to take the right side. If you're feeding from the right breast, then you have to take the child on your left hand. And you have to make a wedge type of thing and keep your child as close to your breast as possible. If you're feeding from the from the right breast, then you have to take the left. If you're feeding from the left breast, then you have to take the right hand and make like this and keep it near the mouth of the child. There are certain children who are very heavy. So mother can use a feeding pillow, like keep the child on the feeding pillow, but the child should be nearer to the breast, as near as possible. Now, the second important thing is burping. Most of the most of the delivered female, most of the mothers forget to burp their child. Burping is keeping the child on your shoulder and just stroking with the hands on the back of the child. So once the child burps, the milk goes inside the stomach and it will not remain at the trachea, and it will prevent the child from aspiration syndrome. So there is a word of caution which I want to add. When I was a house surgeon or when I was a junior doctor, many times when we used to go for the round, we used to see that a child is lying, I'm sorry to use this word, dead in front of the mother. Because the mother had fed the child lying down at 4 a.m. and unfortunately that milk has gone inside the trachea of the child, which is known as aspiration. Please, I request all the newly mothers, never ever feed your child lying down, because it can lead to certain serious aspirations, which of course cause lot of problem both to the mother as well as to the relatives. The third thing which the mother sometimes feel, how much milk is sufficient for my child, whether I will be able to feed him properly, whether more milk is required from outside. No, it is demand and supply. As much as 750 ml to 1 liter of milk can be given to the child by the mother. It appears amazing, but it is so. If your child requires more milk, he or she will suckle the breast more frequently and more milk will be expressed. If the child does not require more milk, then the child will be satisfied with the amount of milk that he is getting. So don't ever get worried or bothered that my child is not, he has not been properly fed, I should give bottled milk. Please never ever do so. Never give formula milk to the child once you can breastfeed. Then we come to the advantages of feeding the child. Why are we so much after breastfeeding? Because breastfeeding is a very good thing which helps the child to develop into a better psychological person. As far as the infection in the child in first 3 months are concerned, breastfeeding takes care of that. There are less visits to the pediatrician, and there is a very good psychological as well as emotional bond between the mother and the child is born, which remains throughout the life of the child. And the mother also feels very happy feeding her child. She thinks that she has attained the real motherhood. So never ever, if you can feed your child, never ever do this that I am not able to feed my child, I cannot do this, I cannot do that. Please make all the efforts to feed your child, as your child is going to be a very healthy child. As far as the mother is concerned, it has very much advantageous to mother also. It has been seen in certain studies that those mothers who feed their child frequently or have fed for more than 6 months to 1 year, they suffer less from gynecological cancer like breast cancer and cancer of the ovaries. Plus, These children, when they go further in their life, they are better psychologically as well as nutritionally, and they suffer from less of the so-called nowadays the diseases which are known as lifestyle diseases, diabetes and heart disease. It has been proved and seen that the incidence in these children who were breastfed are very, very less. Now, we are always talking about the child. We have to talk about the mother also. Because breastfeeding is not one day job. It is 6 months, 1 year, 1.5 year, sometimes 2 years. So in these times, the mother becomes very tired. She is a human being after all. She has to do other chores also. So you have to psychologically support the mother. You have to emotionally support the mother, and you have to physically support the mother. Physically means you have to make her comfortable, and you should, whenever it is possible, should give her support. Come on, I will take care of your child. You can do this and that. And you should ask her to sit in an upright position, not sagging, not doing like this, which will cause backache. She should sit very nicely, either in a couch, or she should sit on a sofa or on a chair or even on the bed. But her back should be straight so that, she does not develop backache. Apart from that, we have to take care of the nutrition of the mother. The calorie requirement of a mother when she is pregnant is only 2,500 kilocalories. But when she is feeding her child, it becomes as much as 3,000 to 3,500. So these mothers should be fed very nicely. Very nicely means we should give them healthy food. Not that you are making a halwa and putting a lot of ghee in it and you say, eat this. No, that will just increase the calorie, but it is not so healthy. But you can give her fruits, you can give her vegetables, you can give her other things like dalia, you can give her proper nutritional food, you can increase the amount of protein in her whatever she is taking, you can do extra supplementation of the feed that she takes, you can give her more milk, more dairy products. Idea is that give her more nutrition. When she will feed the child, when she is better nutrition, then it will be always better for the child. Second thing that we have to take care is whenever she feeds the child, she should be well hydrated. Because studies have shown that if a mother is well hydrated, her milk is more. So before feeding the child, she should take either a cup of milk, or she can take lassi, or she can take some lemon water, or she can take some coconut water, or whatever she wants to take. If sometimes nothing is available, then even a glass of water is sufficient to make her hydrated. The hydration will definitely increase the amount of milk and production to the child, and child will feel much happier. And now there are certain mothers who are not so fortunate. I mean, they cannot feed their child for more than 6 months and they have to go on work. They are known as working mothers. So I have solutions for them also. Although these mothers require more psychological support from the family, from the people they have around, from their maids, we can say, from their office bearers, and from other people. Because we have to motivate her to continue feeding even when she has joined her duties. Usually in Rajasthan, the maternity leave of a government servant who is working in government setup is around 6 months. But we always say that she should feed more than 6 months. Now what the poor lady is going to do? So there are support groups for such females. In certain offices, in certain government offices, or even in some MNCs, there are rooms made which are known as nursing rooms for the mother to feed her child. It is easier said than done because every time the mother cannot go and feed the child, like the distances in metro cities are so much. But if she has time, if her house is nearby, if she gets the opportunity to feed the child, she should do so. And mind you, in government offices, they will not take any charge of it. It is free. They will not say that why you have gone. It is done from Government of India, that she is allowed. It is her legal right. So this type of facility has been given to the nursing mothers. But those mothers who cannot do so, so there is an option for them which is known as expression of the milk. Previously, we were not having very fancy instruments, but nowadays we have proper electric, they are totally pumps which are there, which can be kept on the breast and the milk can be expressed easily with them. You can keep the milk. There is the rule of 5, I tell you. 5 hours milk you can keep in the normal room temperature. 5 hours, 5 days you can keep it in the fridge. And you'll be surprised that you can keep it for 5 months in freezer. Although that usually these type of things do not arise. Usually it is the mother comes back and she starts feeding her child. So this milk which is expressed with the help of breast pumps should be stored in a clean bottle and should be kept in fridge. The other person who is helping you, who is supporting you, should always make effort to feed child with those bottles. And of course, she or he should be given instructions to burp the child after the feed. Supposing the mother has got, say, 6 hours of work, so she can make 2 bottles and keep it in the fridge. Supposing her working hours are more, then at the workplace, her breast becomes engorged. So she should express milk there, and if there is a facility for fridge, she can keep it there, or she can keep it at normal temperature, and when she goes home, she can feed her child. The idea of doing this is that the mother's milk goes to the child's mouth. When she returns home, after, of course, having a cup of milk or something, she should immediately feed the child. Because the bond between her child, which was left for, say, 6 to 8 hours, is reconnected. And more milk will come as soon as she will start feeding the child. It is amazing. People think how it will happen. But the moment the child will suckle the breast, milk will start coming. So immediately when she reaches home, after, of course, freshening up and taking some nutrition, she should feed the child. And she should keep on feeding on Fridays and Saturdays and Sundays as demand feeding. Because these are the days when MNCs give leave to the working people. The second thing is that so many mothers are very much worried. Madam, hum bachche ko kitni baar doodh pilaएं? So nowadays it is demand feeding. Your child will demand that I'm hungry, mama. He will or she will start crying and you will have to feed. So previously when we were feeding our children, we were given this idea, you have to feed by the clock. 2 hours, 3 early, 3 and a half. So we used to always see the clock. Oh, it is 3 o'clock, time to feed the child. But nowadays the dictum has changed. You feed your child whenever he is hungry. It is known as demand feeding. It is very good for the child. And the child also feels satisfied. The second thing, how do you know that your child's stomach is full? That after having his milk, he will leave the breast. Sometimes they do not leave because they want to have some more psychological satisfaction by sucking the breast. But most of the time, when the child he is fed properly and he feels full, he will leave the breast. So don't worry. The certain questions were asked by me, by the people. So I just want to clarify. One of them was that, can a small breast feed the child? Please do not bother about the size of the breast, because it is the glands in the breast which make the feed, not the adipose tissue or the fatty tissue. So during pregnancy, do not get discouraged that I will not be able to feed my child if my breasts are small. Now the second thing was, certain people or some of my patients, they ask, Madam, will the size of my breast come to normal? I tell them yes. Once the weaning, that is when we stop the feeding, the size of the breast will not come to normal, but what we call as near normal. So it will come to near normal. Few mothers are very much bothered about the sagging of their breast. But postnatal exercises, if they do, and they take a support bra or the sports bra, which is known as, then the sagging will not occur. And you should not worry about these small things, I mean the mothers, because these things will take their own time to settle. But please, because certain females also think that it will change their, what do you call, they say that I will not be the same type of breasts as it was previously. And they say it will affect, like, I don't want to feed ma'am because फिर मेरा तो ऐसा हो जाए. So I tell them, no, it is not so. If you will feed, your breast will remain as tight as it was previously. So don't get bothered that I will eat. If I will not feed my breast, I will not feed my child, at least my figure will be okay. No. Please don't have this. Your figure will remain same as it was even when you feed the child. So please make it a point to feed. Now, the last of all is that the children that are, again and again I say, because I really feel that breastfeed is the best feed. So now again I tell you that certain myths, if there, should be taken care of. You should talk to your gynecologist, you should talk to your doctor, and never ever feel ashamed or afraid. Whatever your problems are, if you have a cracked nipple, please come and say, ma'am, I'm having this problem. Don't feel shy. It is, you are a mother. It is a grace to the mother that she's feeding her child. Never ever feel that, oh ma'am, this is like this, I was feeling very shy. No. Come forward, talk to the gynecologist, talk to the doctor concerned, and get all your worries done. So this is I want to tell you in the end, please, whenever you can, breastfeed your child ever, for 6 months, for 9 months, for 12 months, for 1.5 months, even for 1.5 years, even for 2 years if you can, because breast milk is the best milk. Thank you very much for patient listening. I'm very thankful to all of you.
Thank you so much, ma'am. It was such an amazing, viewpoint from your side. And, the mother people here who are attending this webinar and all the kind of people. Is my network stable? Hello? Okay, so I think you can see there are so many people who have already joined. Around 82 are there. And your viewpoint from this on this topic was just amazing. Now I would request Lavesh ma'am to please take the session forward.
Yeah, hello everyone. Good evening. Thank you, Dr. Nirmala Pandey, for such an informative session. Ayushi, can you just clear me whether I'm audible?
Yeah, ma'am, you're audible.
Okay, thank you. Okay, so hello everyone. I'm Dr. Lavesh Pandey. I'm a practicing orthodontist in Jaipur. August 1st to August 7 is celebrated as World Breastfeeding Awareness Week worldwide. And I'm happy to say this. At the same time, I want to express my gratitude to First Step Foundation and other collaborators for taking such a wonderful initiative towards a social cause. The topic of today's webinar is not just like any other. It's a social awareness for the benefit of mothers and our little babies. So today, I will be talking about breastfeeding problems faced by mothers when baby's teeth come out. The process of coming out of teeth is called as teething. We say the baby is teething. You will be surprised to know that in India, Almost 83% of the mothers start breastfeeding right at the birth. But by the time their baby is 6 months old, when the teeth start coming about, the percentage decreases to 55%. So now why does this happen? Teething is one of the main reasons mothers fear and quit feeding. Because the mothers get scared that the baby will bite them, and many a times because of teething, babies become very fussy and irritable, and either they want to refuse the feed or they want to overfeed, both of which causes discomfort and anxiety in the mother, and they are demotivated and quit feeding. So here I want to assure all the mothers that these are very small issues. Please do not quit feeding just because baby is teething. Breastfeeding is the best gift you can give to your babies. So please continue with it. So now when does the teeth start coming out? It is around 6 to 8 months of time. So, but before the teeth come out, the symptoms of teething start as early as 3 to 4 months. The gums become hard and swollen, and the baby becomes very irritable because the teeth are putting a lot of pressure on the gums. So the baby becomes very cranky, and this teething process can result in two behaviors in the child. Either the baby will refuse the feed, or the baby will overfeed for comfort. So if your baby is the one who is refusing feed, so now you have to understand why the baby is refusing the feed. So when the teeth come out, they exert lot of pressure in the gums, and baby feels lot of pain and pressure. So he is not comfortable. So what you have to do is, before you start breastfeeding, with a clean finger, just massage the gums of the baby gently till the baby is comfortable, and then you can start the process of breastfeeding. This way, the baby will not refuse the feed, he will definitely take it. And if your baby is the one who overfeeds when he is teething, means he is repeatedly demanding feeds because of comfort, because he feels comfortable when he is suckling on the mother's breast, then what should you do? Then you have to make sure that throughout the day you do frequent gum massages for the baby, or alternatively you can give some cold things to the baby to chew on, like a cold hanky. You can keep a cotton cloth in the fridge and you can give the baby to chew on. The coldness will produce numbing sensation and it will relieve the pressure from the gums. Or you can give cold teether to the baby. So when we talk about teether, it is a very common practice that many parents, they give raw vegetables like carrot to the baby as a teether. Though it is acceptable, but I feel that carrots, they carry a risk of choking. Suppose if the child bites on the large chunk, then it can get stuck in his throat. And one more thing here I want to mention, whenever you are going to buy a teether, just make sure don't buy those liquid filled teethers, because they have the chance of breaking and the liquid gel can spill inside the baby's mouth. So it's always better to have solid rubber based teethers. And yes, and there is one more common practice which is observed. Many parents, they tie the teether around baby's neck with a string. So because they think that the baby can take it in the mouth whenever the baby wants. But this is very risky for two reasons. See, the teether which the baby is carrying around his neck whole day, it becomes a source of infection because of the germs, because it is not clean. And when the baby chews on it, he will get infection and fall sick. The other reason is when you tie such strings around baby's neck, if the string gets stuck somewhere, the baby might fall or even carry the risk of strangulation. So my advice is just keep 3 to 4 teethers and sanitize them frequently, and best option is to give a cotton hanky. So now here I want to clear some misconceptions which are prevailing in our country and in fact all over the world regarding teething, or means जब बच्चे के दांत आते हैं. तो one of the most common practices, all of you must have heard it, honey, application of honey. सब बोलते हैं दादी और पुराने लोग कि बच्चे के जब दांत आ रहे हैं तो honey लगाओ. Apply honey, this will relieve the baby of the pain. No, let me tell you here that honey's use under 1 year of babies is banned. It is not recommended by World Health authorities and doctors. Why? Because honey has spores of a bacteria called as Clostridium botulinum, which can cause a life-threatening disease in the child known as botulism. So please do not use honey for children under 1 year of age. Now, the second most common practice is applying numbing gel on the gums of the child. Like the gel we adults apply on our mouth ulcers, they should not be used for children under 2 year of age, because the composition of the gel is not safe. And plus, suppose if the numbing gel goes inside the floor of the mouth or the throat of the baby, the gag reflex or the coughing reflex will be stopped and the baby can choke. And one more thing, when the baby is teething, the parents can't see the baby in pain and they give frequent painkillers. This is not advisable. Doctor prescribed painkillers should be given only when severe pain is there or the baby is very, very irritated after consulting your doctor. Please do not make it a regular practice. See, teething will go on for 2 years, okay? So you can't go on giving painkillers for 2 years. So, and one last misconception that is also very common. Everybody thinks that जब बच्चे के दांत आ रहे हैं तो उसको lose motion और fever होगा. Means that baby is teething, it is normal to get fever and lose motion. No, I would like to make it clear that teething process has nothing to do with fever and lose motion. Now, why does fever and lose motion happen? It happens because जब दांत आते हैं बच्चे के, he is putting everything in his mouth, okay? And those items, they are not clean, they carry germs, and those germs, they enter the stomach of the baby and they cause infection. And this infection results in fever and loose motion. So if you maintain hygiene, and then the baby will not get any fever or loose motion, and teething can become a very smooth process. So you have to make sure that whatever items baby is putting in his mouth, like the teether or the toys, just sanitize them and keep your house clean. Wash the baby's hands frequently. Wash your hands before touching the baby or before feeding the baby. And if your baby is in a crawling stage, then keep the floor of your house clean. And one more, during teething, just take care that all the small items like small Lego pieces, bottle caps or ping pong balls, you should just throw them away because they carry the risk of choking in the child. So now I'll come to the biggest problem which breastfeeding mothers face when the baby's teeth come out. That is biting. So biting can turn a pleasant experience into a painful one. So here you need to understand three things. Either your baby will bite you at the start of the feed लेने से पहले bite करेगा या तो, या फिर during the process of feeding, or the baby will bite you during when you're feeding the child, or your baby will bite you at the end of the feed. So now if your baby is biting at the start of the feed, okay, so what you have to understand, why is biting? As I told you earlier, because there is a lot of pressure in the gums. When the teeth are trying to come out, they exert a lot of pressure and baby is irritated. So that pressure has to be relieved. So before you breastfeed the child, just gently massage his gums and make sure that your finger is clean and your nails are trimmed. And when you keep on massaging till the baby is comfortable. And once the baby is comfortable, he will suckle and he will definitely not bite you. And now, if your baby is the one who bites you during the feeds, जब आप फीड करा रहे हैं उस टाइम अगर आपका बच्चा आपको बाइट कर रहा है बेबी, that means your breast is not latched properly in the baby's mouth, or your breast is not positioned properly in the mouth. So as ma'am told earlier, she has already discussed about latching. So what you have to do is, when you feed the child, you have to make sure that the baby's mouth is wide open. You can just put 2 fingers gently between his upper and lower jaw and exert gentle pressure and open the baby's mouth. Baby's mouth should be wide open, and try to put more of breast, not just the nipple. The areola, that is the area around the nipple, should go inside the baby's mouth. This way, if latching is proper, baby will not bite you, he will suckle and it will stimulate the milk flow. So now here, one more thing I want to mention. Around 6 months of age, when the teeth start coming out, it is usually the lower teeth which come out mostly. So when the child is really suckling and you have latched properly, the tongue is always covering the lower teeth. That means the tongue is always there between the breast and the teeth. So there is no chance that if you have latched properly that the child will bite you. So it is all about correct latching. So if you have difficulty in latching, please consult your gynecologist or nurses. They will guide you properly. Now, coming to the third point, if your baby is the one who is biting you at the end of the feet. So that is very simple. That means the baby's stomach is full. So you have to just gently put finger at the corner of the mouth between his gums and release the suction. And make sure that you don't pull away suddenly, as this can cause pain to you. And don't shout, otherwise the baby will get scared. Or sometimes the baby may take it as fun and he will go on biting repeatedly just for your reaction. And also, sometimes babies fall off to sleep while feeding. So they can bite you reflexly. So you have to make sure that the baby is awake when you're feeding. Just keep interacting with the baby. And as ma'am mentioned earlier, do not lie down and feed. Lying down carries the risk of, as ma'am mentioned earlier, it is life-threatening. Plus, when you lie down, the latch of the breast is not proper. So there is more chance of biting. So it's always better to sit and feed the child. Now, I'll come to the last point, which is also very common, that is rashes. When the baby is teething, when the teeth comes out, there is a lot of salivation. The baby is all the time drooling. So the babies get a lot of rashes around their mouth, that is the external area around the lips. And this even happens on the mother's breast. Now, why does this happen? Because the baby is salivating a lot, plus he is putting everything in his mouth. So there is constant friction around the mouth, and this causes allergic rashes. And if hygiene is not maintained properly, then it can turn infectious. And when the mother feeds the child, this passes on to mother's breast. So what you have to do is, if your child is drooling a lot, then you just dab the lips gently. Don't wipe harshly. That can result in skin irritation. Change baby's bibs frequently. And before you feed the child, with clean water, just wipe the outside area, and then you can start the process of feeding. And if you've got allergic rashes and infection, consult your doctor for medication. So this is all I have to say about teething. And I would like to conclude with little bit motivation for the breastfeeding moms. You are doing a good job breastfeeding, but remember, breastfeeding is not a choice. It is a responsibility. And in this journey of yours, doctors are always there for you. So continue breastfeeding your little ones. It's a beautiful experience full of love and warmth. Thank you so much.
Thank you so much, ma'am.
Exit mistake.
Thank you so much, ma'am. This was an amazing takeover from your side. I hope this session must have cleared doubts to all the upcoming parents. As ma'am said in the beginning, breast milk is a nectar to a child. We need to know all the important aspects of it, and I guess you have cleared all the doubts. Also, guys, thank you so much for making this session successful. Thank you so much.
Thank you, Ayushu. You are a wonderful host, and I enjoyed being here with all of you.
Thank you, ma'am.
Thank you so much, ma'am. Thank you so much, ma'am.
Thank you.
And I would like to express warm gratitude to all the collaborating representatives for all the organization. This was a grand success since we have reached almost 96 to 97 participants who are here, who were listening to you. And I'm pretty sure that you have almost cleared all the doubts to upcoming parents. And, we were on some topics we were still unaware about. As ma'am has cleared a lot of doubts about it. And we are delighted to have you two here. Thank you so much, ma'am, for taking time from your busy schedule. Thank you so much.
Thank you, Nandini ma'am. Thank you for giving this opportunity. And I hope almost like doubts are clear. Still, if you feel that people contact you, if they have some doubts, you can please forward them to us.
So I will circulate your Instagram page on the participants group. And guys, if you have any kind of doubt, feel free to reach her. And if you have any doubt you wanted to ask here, feel free to open your mic and ask her, or you can either write in the chat box.
Thanks a lot.
Thank you so much, Nirmala ma'am. Also, guys, please switch on your camera if possible. The rest of the participants, if possible, please switch on your camera. Thank you so much, Shikha ma'am. Still people are joining. Okay.
Nandini ma'am, here I want to mention something.
Yeah, ma'am.
Here we have with us Dr. Shikha Dua. She is an eminent ophthalmologist. So I welcome her here. Thank you, Shikha ma'am, for joining.
Thank you so much, ma'am, for joining. She was the one who made the video on eye flu. Guys, please reach out to her. She had to almost come down.
Thank you so much.
Yeah, if you want to say something, just feel free to do that.
I just want to congratulate Dr. Lavesh and Dr. Nirmala ma'am. Thank you so much for the very, very well explained talk and clearing all our doubts. I'm sure everybody's doubts are clear. It was an excellent talk. Thank you, both of you.
Thank you so much, Shikha ma'am. Okay, guys, if you have any doubt, feel free to ask. We are here for next 2 to 3 minutes. If you don't have any doubt or you are feeling hesitant, I'll circulate her link. I'll circulate her Instagram page on the participants group. Feel free to reach her there. Otherwise, we will wind up the session. Okay, ma'am. Also, guys, please fill the feedback form I'm going to circulate in the group right after this webinar. And once again, thank you so much. The session was a successful one. Thank you so much, Nirmala ma'am and Lavesh ma'am, and rest of all the participants who attended the session.
And you guys are doing a great job with this NGO, and I would like to, contribute in any way I can with my services or anything.
That was so sweet of you. So I think we can wind the session now.
Yeah.
Thank you, Nandini and the team. You're doing a wonderful job.
Okay, guys, you can leave now. Once again, thank you so much for joining.
Thank you. Bye-bye.
Thanks a lot.